So just find yourself in a peaceful and quiet place, and just make sure that your body is in a comfortable position. Your feet are on the ground and your arms are lightly resting on your side. And close your eyes. Just take a couple of deep breaths. So draw the air through your nose, fill up your lungs completely, and then exhale slowly through your mouth. And as you exhale, you let go any tension or worry that you may be having. So again, take a deep breath through your nose, fill up your lungs, and then exhale slowly from your mouth and releasing any tensions, any worries. We do it a couple of times more. Take a deep breath in, fill up your lungs, and release slowly from your mouth. One more time. As we do that, we are grounding our mind, our body in a present moment. Gently continue to breathe. Now take one hand over your heart, another on your abdomen, and feel the warmth of your hands. Again, breathe deeply through your nose and breathe out through your mouth. And as you continue to do that, just notice the rise and fall of your chest and abdomen. Now set an intention for this session. Bring it up in your mind. And feel it into your body. Your intention for this session. Continue to breathe and ground. And when you feel ready, just gently open your eyes. Wriggle your fingers or toes and come back into the room, being present here. So this is our 100th session that we are doing over the last 2.5 years. And today the topic is working with the inner child. So how do you reparent so that you can, your inner child, so that you can create space for growth and healing. And so what we will do is we'll get into the concept about it. I think it's important to understand, and also understand the impact of inner child experiences or childhood experiences that create what we call the inner child and the link to that. And then we'll get into a little bit into the emotional wounds and the reparenting process. How can you reparent an inner child which could be wounded? And understanding the process theoretically, then we'll get into the real doing it. So we will today move from just going into understanding it, and then I will make you aware of what you want to work on through the questions, and then we will get into connecting with the inner child and then see what and how it wants to heal or how you are going to reparent it in your own context. And then we'll close the session and then we'll come back for Q&A. So let's get into some of the definitions. Okay, as usual in the beginning, we always give us an aspect of understanding in theory. So the inner child is a metaphorical representation of our own childhood or part of what happened in childhood or what we call childhood self. Is not literally a child within us, but it's like a figurative energy or block, or we call self, that one holds due to our childhood experiences, emotions, and memories. So, for example, when someone feels irrationally fearful in a present moment, that may resemble a childhood trauma. It is their inner child that is responding to a trigger or something that's happening in front. Psychological significance is that this concept is important in psychology as it helps to understand how childhood experiences shape adult behavior and emotional health. Okay, and it's also a tool that is used to address unresolved childhood issues, which then helps to bring greater self-awareness and healing. An example can be an adult who struggles with trust in relationships might find that their inner child was hurt by broken promises in childhood. And it has an historically, so the concept of inner child has a root in psychoanalysis and development psychology with big contribution by Carl Jung. And it gained popularity in therapeutic practices as a way to address deep-seated emotional issues from childhood. Okay, and in many therapies, including what we practice here, we always go and find when we do the healing in childhood, you'll find the inner child as an archetype that holds the memories of what happened that were not resolved in the early childhood and that you can resolve now by going and connecting with it and helping you to have a better understanding of what happened there. So the inner child is a key concept in understanding how our past experiences, especially from childhood, continue to influence our current emotional and psychological state. And recognizing and nurturing these aspects of ourselves can lead to profound change. In my practice, I've never seen one scenario where basically we did not find something in the early childhood which was creating an impact in the present moment as an adult. And so, what kind of impact does childhood experience have? So, they have an influence in the current adult behavior. I mean, childhood experiences have both positive, and it's not only just negative, it has both positive and negative profound impact on who we are as an adult. Okay. For example, if somebody had a very nurturing and supporting childhood, you would find them with high self-esteem, better relationship skills. Conversely, if there was neglect or abuse in childhood, then you will find person having trust issues or emotional challenges in later part of life. And of course, there is and the nature of, and the key aspect is the role of attachment in the early childhood, especially from caregivers, because that shapes our approach to relationships and self-image. If there is a secure attachment, typically it leads to healthier relationships, while an insecure attachment can result in difficulty in trust and intimacy. Okay, uh, a kid, a child, which had inconsistent attention from caregiver, parent, or even teacher, might struggle with anxiety in adult relationships. And one of the key issue that you find, especially in relationships, is a fear of abandonment. Now, this comes from absolutely typically very early childhood examples of what happened to the child from one of the caregiver or both. And of course, traumatic earlier childhood experiences can lead to long-term effects. I mean, PTSD, which is kind of label given, but these are always aspects which come, most of them come from early childhood, anxiety, depression, and other mental health issues. And one of the thing is that all kind of resilience factors like supportive relationships or therapy work can mitigate these aspects, okay, which is what basically we try to do. I mean, take an example, a child who faced bullying might develop social anxiety. This is exactly what I faced for a long period of my life, because I had childhood bullying. Okay, so it was very difficult for me to be in in a public place, and only because of the work that I've done that I am able to resolve that. So childhood experiences are foundational to our adult life. I think we probably all understand that very well. Okay. And the key is understanding and acknowledging these influences actually helps healing and personal development. So by when we go deep into the work and we start to understand where it comes from, what happened then, and what can be done by a strong self, which is you, which is connecting to the inner child, can help to both heal, but at the same time starts to have a better, much more healthier life in the present moment. So these are typically 4 steps for healing and reparenting. The first one is to recognize that there is an inner child which has needs, and this involves identifying the emotions and the behaviors that stem from the childhood experiences. Okay, for example, an adult experiencing intense fear from, let's say, an animal, okay, actually may have had an experience of being bitten by that animal when was very young. Okay, and so this is just to say that in an adult you may have something which is coming from an early childhood. And the second step is communicating and engaging with the inner child in a specific way to create a dialogue. But the dialogue has to be done in a place of deeper understanding and compassion for the little one. And so we will do it in the session today, wherein you might be able to mentally converse with your younger self, offering comfort, understanding their past hurts, and helping them to heal it. But then the third step is nurturing and reparenting. So connecting to it, understanding what it went through, is only one of the most important steps. Um, but then you have to continue to nurture. Okay, so the reparenting process really involves constant care and support to what the inner child missed. This can be done, of course, in a circumstance where you have self-compassion and creating a very nurturing inner environment like we will practice today. Okay, and an individual might develop self-care routines or affirmations or connection to the inner child that you would continue to do on a day-to-day basis. That then helps for it to be reparented. Okay, and then of course integrating whatever comes up from the valuable experience, because there's a lot there. There's a As soon as you take away the emotions, there's a lot of wisdom that comes from the experience of the inner child, okay, what it went through, and integrating that leads to much more cohesive sense, so it helps to heal. So by accepting the and loving the inner child, person can feel complete, capable of handling life challenges. And we are going to see how we can practice this today. At the end of the session today, I will also give you what I recommend as a 10 days practice, which is exactly the step number 3 and 4 that is here. So the healing and reparenting process is about acknowledging, understanding, nurturing, and integrating the inner child. And it normally leads to self-discovery and healing that helps you or individual address deep-seated emotional wounds from early childhood, and that leads to, as you integrate them into your current life, something starts to shift in your current life, and you start to see you react differently to the same situations because the inner child is not in a place of fear or pain as it what it went through. And it helps to, of course, foster emotional resilience and stronger sense of self. Okay, so before we go forward, I would like you to think about your situation. So I send you questions before so that you can think about your own situation, and you may have multiple experiences that you want to look at. So can you recall your specific childhood memory experience that resonates with for you today and that continues to be challenging? Okay, so just take a moment and write down a few of them. You can take note of a couple of them and then choose one that you want to work today. And as you will have the recording, you can always go back and start from here again so that you can work on multiple aspects of childhood. So it's okay. And think about the idea of nurturing and healing your inner child, parenting it. What are some of the things that you hope to grow, that you want to change in yourself? So take a moment and just write it down and see if you can choose one that you would like to work on today. Okay, so see if you have chosen one that you would like to work on. And here we go. So I want you to just be in a comfortable position. You can have your eyes closed. You can keep your eyes open. And if you want to take notes, you can always keep pen and paper by your side. But just see if you can relax. Now begin by taking some deep breaths. Draw air through your nose and then exhale from your mouth. Another time. And maintain this rhythm for a few moments and ground your mind and body in the present moment. Take a breath in through your nose and breathe out through your mouth. Now find the inner child and the related issue that you want to work on today. Just connect to it. Think about it. And as you bring it into your awareness, notice where in your body or around your body you feel some kind of sensation. Just notice the area in your body, around your body, where you have a sensation. As you think about the issues you want to address today. And as you focus there, observe any sensations, any emotions, or thoughts that start to surface. Don't judge them, just focus and observe them. What are the emotions that are coming up? And if there are any thoughts that are coming up. And take a moment to observe, breathe into that area wherever you feel it, and see if you can become curious and, if possible, compassionate towards this area. You're curious because you want to understand more. And see if you can be also compassionate because you're connecting to something that has happened in the past. And you are here to helps resolve. So be compassionate. And you can always ask not to be overwhelmed, and you can acknowledge its presence and role in your life. So stay there, starting to be a bit curious about what happened then. So continue to be in this place of curiosity and compassion, because this will allow space for it to communicate with you. And you can reassure it that you are here to understand and support. Now see if you can connect back to that sensation that you felt in or around your body and ask it a question. Ask it, what is your intention for me? And notice what you hear. Remember to stay curious and compassionate. If you feel sadness or anger, just breathe into that area and wait till you feel curious and compassionate. So you're asking, what is your intention for me? And hear what you hear and see if it makes sense for you, what you hear. And if it does, acknowledge it. And if you hear any conflicting voices that start to come in, you can always ask them to kindly step away into a waiting room so that you can focus on the sensation that you feel attached to the inner child and have a conversation from a place of curiosity and compassion. Ask another question. Ask, what is it afraid will happen to you? What are its fears? And see what you hear. And ask it, if that happens, what are you really afraid would happen to me? What is your ultimate fear? And remember to stay in a place of compassion and curiosity when you hear it. So what you heard is what your inner child is trying to protect you from. So see if you can acknowledge it. Saying, I understand. And notice how it shifts as you acknowledge the fear. And now ask it, how old was it when it all started? And normally you will hear an age, a number. And just notice the number, the age. And you can further ask, what was going on then? And see what you are shown. And remember to stay compassionate and curious always. If you feel otherwise, just breathe into that area where you have the sensation till you feel calmness. And still ask the question, how old were you when it all started and what was going on then? Notice what you are shown, what you hear. So acknowledge it. What you are being pointed is when the little one, the little child, how old was it when it all started? And this is the inner child that we are here to hear from and heal. Now ask it, would it allow this little young self, the little one with a certain age, will it give the permission for you to heal the younger one, the inner child? Ask for permission and see what you hear. If you hear resistance, ask what is it afraid would happen, and please listen with compassion. If you still hear resistance, then ask the question saying, what needs to happen before you will give permission to heal the inner child? And take note of what you hear and see if you can acknowledge. Now see if you can ask again for permission to heal the inner child. And if you do get a permission, then let it know that you're going to work with the little one now, and see if you can bring that little one, the age that it told you when it all started, and have that little you standing right in front of you, looking towards you. And as you see the little one in front of you, notice how you feel towards the little one. If you feel sadness or anger or resentment, just breathe within yourself till you calm down and feel compassion for the little one. So take a moment till you feel compassion towards this little one that you see right in front of you. Now notice if the little one is looking at you or looking away from you, or if it's looking for some form of assurance from you. You can even go closer to the little one if it allows you. And ask the little one how does he or she feels about you being in front of the little one. And see what you get as an answer from the little one. See if you can now feel compassion towards the little one. And let it know that you are here to support it, to understand what it went through, and to help it release if it wants to. Stay open, stay compassionate. In a very loving voice, ask a question as to, can you tell me what you went through? All your challenges, all your pain, all your suffering. Don't overwhelm me, but tell me everything that you went through. And hear what you hear from the little one. Just stay compassionate and hear everything that it wants you to know about what it went through. See if you can acknowledge what you hear from the little one, what it went through. Stay curious, stay compassionate, and ask a question. What should have happened then that did not happen? Something should have happened then for the little one that did not happen. And see what you hear. And in your own words, how will you assure the little one that this happened in the past and now you are not going to have the little one go through it again? So, in your own words, give the little one some form of assurance that it will not happen again. In your own words. And see if the little one feels assured. And now ask a question. Would you like to the little one, saying, ask the little one, would it like to leave that place in the past and come to a place where it feels safe? It can be with you or it can be somewhere else of his choice. And if you hear no, or it doesn't feel safe yet, ask it what needs to happen. Ask a little one, say, what needs to happen for it to leave that place in the past and come to a place of safety? What needs to happen? And see what you hear. And see if you can acknowledge what it said needs to happen before it will leave that place in the past and come to a safe place. And if it agrees to come to a safe place from the past, come to you or any other place, see it going there. Most of the time, the inner child wants to come to you. So you can invite them to be with you or wherever they feel safe and have them being there. So see them being in that place. Yeah, so see if you can bring the little one into that safe place. Now ask the little one, where do you hold your difficult emotions, all the pains that you went through in your body? So ask it, where does it hold all its emotions and pain in the body? So you will hear some places in the body where it holds. Take note of that. I invite the little one to release all that it holds, all its pain, all the suffering, everything into either water or fire or earth or into air. It can choose. So first you ask the little one, where do you want to release all of your pain and suffering? So if it says fire, then you light up a fire. If it says water, then you create a water body. If it says air, then you let it release into air. If it says earth, then you dig a hole for it to release. And now ask it to release everything that it holds in the physical, in its body, where it pointed. I hold my pain here and here. So ask it to release from that place in our body into water, fire, earth, air, and wait for it to release till it's done. Take the time. Ask the little one if it would like to release anything else other than what it told you into water, fire, earth, or air, and let it do. And you observe and wait till it's done. Now ask to the little one, what qualities did it lose as a consequence of what it went through in the earlier childhood? What qualities would it like to bring that it lost due to what it went through? So see if you can, if it'll name you some qualities. Can be trust, can be freedom, can be whatever. Qualities that it lost due to what it went through. So I'll give you some names. Just hear them out. And now take a few moments to bring those qualities into every cell of your body and the little one's body and see them come into you and into the little one. And let those qualities be well integrated into you and the little one. And see if you can let the little one know that you're going and to come every day to check on the little one, to know where it is for next few days. Assure you're coming back in your presence with the little one, in your own words. And now take a moment to thank all your system, every part of your being, for being here. And take a moment to share within you your vision of life, what you are looking for you. And now just take a moment to picture yourself and your inner child surrounded by warm, nurturing light. This light represents the compassion, the understanding, and care that you have extended to your inner self today. And imagine yourself as a nurturing caregiver to your inner child. With every breath, send love and compassion in. understanding and acceptance to this younger version of yourself. Feel the connection between your current self and this younger version of you, the inner child. This bond becoming stronger and more loving and more compassionate. Now slowly start to bring your awareness back to present moment. If you had your eyes closed, just start to open your eyes and carry this sense of compassion and understanding with you. Remember, the journey of healing and reparenting your inner child is an ongoing and deeply personal journey. But being here today, just be grateful for yourself. Thank you for being here. And we will open a session of Q&A where you are invited to share whatever you would like to share. And we may listen to each other's story, hold each other in compassion. Remember not to get overwhelmed by others' experiences. We are all here to support and understand, and not to absorb anybody else's emotions. Thank you for your presence.